So today we're going to take a look at how nature-based early childhood programs in Scandinavia support holistic development physically, cognitively, socially, and emotionally. And we'll connect this model to key developmental theories and discuss its implications for our practice, especially when working with young clients or families navigating school systems, trauma, or developmental concerns. So forest kindergartens began in Denmark in 1952. Um, And these schools are rooted in progressive education traditions like Waldorf or Reggio Emilia. And at their core, they prioritize child agency, minimal adult intervention, play-based learning, and nature as the primary educator. So this model offers a counter narrative to rigid developmental expectations, and it invites us to consider how autonomy, sensory integration, and open-ended play might support children who are neurodivergent, have experienced early adversity, or are navigating multiple contexts, cultural contexts. So there's four foundational principles that guide these schools. Sensory rich learning, which supports deeper neural development, aligning with trauma informed frameworks and sensory based regulation strategies we might use. Free play encourages intrinsic motivation, autonomy, and creative self expression. And these we know are protective factors for children experiencing anxiety, adjustment issues, or perfectionism. Mixed age learning, which promotes modeling, empathy, and pro social behaviors, all of which contribute to the development of secure attachment patterns. Scaffolded risk taking, which enhances confidence and frustration tolerance, which is key to supporting emotional regulation and resilience building. So, especially I think, in children who may have experienced controlling or chaotic environments. So, these principles can inform how we think about therapeutic environments, play therapy, or even school-based counseling interventions. So, nature offers a really dynamic and demanding physical landscape. Children in these programs develop stronger motor skills, better balance, coordination, and even improved immune function. So, I think this is a reminder of that mind body connection. Gross motor activity is foundational to emotional regulation. Did you know that? And executive functioning. And children in therapeutic settings often do benefit from movement based interventions, especially those with trauma histories or sensory processing challenges, or those who have difficulties sitting still in conventional therapy environments. So encouraging, I think, outdoor embodied experiences is a crucial part of treatment that you might want to discuss in some psychoeducation with caregivers. So natural environments reduce sensory overload and support sustained attention. So in contrast to overstimulating indoor classrooms, outdoor space promote um, concentration, systems thinking, real world problem solving. So we often see young clients labeled with attention difficulties or behavior challenges that stem from, in my opinion, environmental mismatches. And I think this forest pedagogy reminds us of the importance of context sensitive assessments and the dangers of pathologizing children whose developmental needs maybe aren't being met by rigid systems. So I think of nature as being the potential for it being a co-therapist, especially in modalities like ecotherapy or trauma-informed play therapy. These types of environments, which I am super in love with, foster confidence through mastery, regulation through sensory activity, empathy and cooperation, and authentic conflict resolution. So, forest kindergartens cultivate resilience and emotional intelligence, which align with Erickson's early developmental stages like initiative versus guilt or industry versus inferiority. And in counseling, I think these capacities help buffer against toxic stress and support post traumatic growth. So, group work, um, or even sibling therapy can draw inspiration perhaps from these peer-based collaborative learning environments. I'm draw I mean, it sounds wild that I'm drawing that parallel, but I think it's possible and I could always say more about it. So, um loose natural materials basically invite children to construct meaning, tell stories, and solve problems imaginatively, which supports symbolic thinking, narrative identity formation, creative expression as regulation. And in therapy, especially play therapy, we can see how open-ended materials can reveal a child's internal world. So, forest kindergartens affirm the value of symbolic play for emotional processing, which supports both diagnosis and intervention. So, I think for children recovering from trauma or experiencing anxiety, imaginative play can serve as a form of emotional rehearsal and mastery. So these programs include calibrated risk. Children climb, balance, and even use real tools, and this helps them again build resilience and frustration tolerance, develop accurate self-assessment, and practice emotional flexibility after setbacks. So this challenges dominant U.S. paradigms that equate safety with control. And I think we often work with caregivers who are fearful of letting children fail or fall even, and we can use this model potentially or draw inspiration from this model to reframe risk as growth, not trauma. So, um, there are 6 types of risky play that are especially relevant for clinical work. I think with um, anxious or overprotected children, and I think, again, it can help normalize the developmental need for adventure and autonomy. So, forest kindergartens are part of the national curricula in Nordic countries and are spreading globally. As they do, each region is adapting the model while preserving core principles. So, I think this again raises the question about cultural responsiveness and the ecological validity of our interventions. But of course, not all families, especially here in New York, most families won't have access to forests or trust play-based learning, especially those navigating poverty or migration. But we can advocate for equitable access to green space and nature-based interventions that are culturally sensitive and community informed. So this also aligns with Brenner's model, emphasizing how macro system factors like policy and culture shape development. I mean, just as an aside, there are forest kindergartens here in New York. So, in some, Nordic outdoor kindergartens promote well being through stress reduction and embodied learning, support holistic development across all domains, encourage environmental stewardship, which is fostering empathy beyond the self, offer a model for educational innovation that centers on play and autonomy. And I think it challenges us to reconsider our assumptions about risk control and resilience, perhaps motivates us to advocate for developmentally attuned environments, perhaps again inspires us to integrate nature play and sensory experiences into our therapeutic frameworks. I think it could help us equip caregivers and educators with strategies that support self-regulation and emotional intelligence outside therapy space. And I think as we consider the impacts of technology, climate change, and inequality on development, forest pedagogy offers a grounded, healing, and forward thinking approach to supporting children and families.